My name is Morgan Gache. I am the CEO of the Calaveras County Chamber of Commerce. Thank you so much for joining us on our Unpacking the Hair Salon and Barber Roadmap. And this is a very, very exciting moment. My roots are very excited for this moment. And was so exciting yesterday when we got the official word and we got the guidance. And so we are excited to share with you. There's a little bit of technical difficulties on some of our panelists' end, and so they will be on shortly. But I wanted to get the ball rolling and started. So I told you already, my name is Morgan with the Chamber of Commerce. We also have Colleen on. Colleen, do you want to introduce yourself?
Sure. Good afternoon, everybody. My name is Colleen Rodriguez, and I'm the Deputy Director for Public Health, which is a division of the Health and Human Services Agency right here in Calaveras.
Awesome. It's helpful to have the partnership that we do with Health and Human Services, the Public Health Department, because that's a lot of the questions that we get. It's a lot of the question marks on how do we implement this? What does this look like? And so because we're operating a little off the cuff because of technical difficulties, Colleen, would you mind just giving us a little bit of an explanation of the attestation and why we qualify right now to officially have barbershops and hair salons open?
Sure. So as everybody knows, the governor, issued a stay-at-home directive. Gosh, it seems like 1,000 years ago, doesn't it? But it wasn't that long ago. After a little bit of time, he determined that because of the certain numbers of various counties and jurisdictions, that some jurisdictions were allowed to apply for what's called a self-attestation, which was basically, and you can actually find it on our website, and I'll put the link to that up in just a second. But it was basically a series of questions that we had to answer that related to our case numbers, related to our testing capacity, and related to our reaction and how we would respond if we got various scenarios, basically. We applied for that, and we received an attestation, which was great, and that allowed us initially to be able to expand retail, and then the governor just announced yesterday that it also is allowing us to expand hair salons and barber shops. And so again, this is something that's not being offered to the entire state. At this point, it's only being offered to those jurisdictions that have received the attestation. So we're fortunate in Calaveras that we are one of those counties.
Yeah, thank you, Colleen, for sharing that. Colleen is a wealth of information, and as you can see by her picture here, her hair is flawless despite the shelter in place. So she is good there. Because we're doing things a little different, because of, again, apologies if you are just fresh on our call. We're having a little bit of technical difficulties from some of our panelists, but there are a bunch of you that are on, and I'm so appreciative for you showing up. And really what makes these roundtables the most effective is by your involvement. So I want to encourage you on a couple of things. First of all, please raise your hand. I know that it sounds kind of cheesy, but if you have the capability, raise your hand if you have questions. Awesome. I already see that someone practiced that. And then also, if you want to just put something in the chat box, feel free to comment in the chat or in Q&A, and we will call you up. If you would like to actually be on the call and ask your question live, just raise your hand and we will have you jump on. There is some neat formulations that are happening, and I'm sure all of you have already seen it, but in case you haven't, I am going to do a quick screen share here. So bear with me here for just a moment. So for those of you that have not seen yet, the Resilience Roadmap, if you go to covid19.ca.gov/roadmap, and this is where you're gonna find actual guidance for you. And where we're gonna go is to the county variance page. And we also have connections to the county page. And so we'll show you that here in just a moment. But if you scroll down, you're actually going to be able to see hair salons and barbershops. So later on, as soon as Kathy Glino is able to hop on, she's going to describe this guidance. And if you have not seen this yet, this is something that you're probably going to want to go through ASAP. If you're planning to open now, if perhaps you've already like started taking appointments today, this is something you want to make sure that you are following and going through. It's a little different than some of the prior sectors that we've talked about. So if you've joined us for any of the retail or restaurant or real estate ones, it is different. There's not a checklist for this one, so that's slightly different. So I wanted to highlight that. And then there's one other piece, one other tool.
Morgan, can I jump in real quick before you go away from that one? So we've been getting a lot of questions about why the guidance for both hair salons and barbershops and for places of worship, why those are kind of in different places. And I just wanted to clarify because for places of worship, that guidance it applies to the entire state. For hair salons and barbershops, that's only for the counties that receive the attestation, so that's why it's in a different location. So I know it's a little bit tricky to find, but if you go to the part of the website that says county attestations or by county by county attestations, it's right in there. So just want to put that out there. Thanks.
I'll put the direct link to this PDF too in the chat, and it will also shortly be up. Thank you, Colleen, for that. I wanted to point out one other thing. Calaveras.org is the Chamber's website, and in our partnership, we've collaborated on a document called the Back to Business Toolkit. And there are a lot of materials in this Back to Business Toolkit, and it's a live document, meaning that we have the data up here because we're constantly updating it. So I wanted to briefly show you this, and we'll get to your chats and your questions here in just a moment. So make sure that you're either raising your hand or putting the questions in. But I wanted to highlight a few things. We have this table of contents that gives you CDC, OSHA guidance, links to everything, because that's important to know what the most updated information is going to be. And we have the counties. I know Calaveras County is going to have their infographic for the Roadmap to Recovery up soon. And we also have YouTube video explaining a little bit of the reopening that's happened and how we've utilized the Resilience Roadmap. This is critical because, as Colleen mentioned before, we're following state guidelines. And so we are not trying to reinvent the wheel. We are literally pointing to the state guidelines and had this roundtable to help kind of dissect and help you understand those guidelines a little bit more clearly. We have the OSHA. I wanted just to point out a few things that are cool, some marketing tools that are great. PPE providers. I want to pause on this briefly for two reasons. First of all, the Chamber currently has free PPE. I'm sure you've heard this because it got blasted out everywhere, but the Chamber, thanks to Health and Human Services, has free PPE. Currently, just masks and gloves. My sanitizer is out, but we hopefully will be having more coming in. I'm saying this because this is a great gift that they have given to businesses, and it's kind of a buffer to hold you through until you receive your PPE. So it's in recognition that a lot of vendors are even pushing out by a month or more if you're ordering PPE. I'm highlighting 3 here that are all actively telling me that they have PPE, and I know 2 of the 3 have free same-day delivery. So please use these contacts. Don't Google and then get the information. Use these contacts, because if you call, say, for example, Ferguson, and you get their general number, it's not necessarily going to get you to the right person. So I just wanted to highlight that there. If you are looking for free PPE to get you over until you receive your order, then please contact me at the Chamber. And you can either do that through email, which is MGACE, so M as in Morgan, GACE calaveras.org, or you can call our number, which is 209-754-5400. And I will put all of that information in the chat box here shortly. So I wanted to highlight those. There's catalogs for each of them. And then there's actual signage too that you can use. And this is not county or state ordained. It just follows the guidelines that they have. So if you need signage, if you need employee check-in, employee training guidance, any of that information is at the bottom here of the Back to Business Toolkit. So I wanted to highlight that briefly. We have Debbie on the line as well. And let's see here. Debbie, do you want to introduce yourself? You might be muted.
Good afternoon. Hi, this is Debbie Pawnee. I'm the Executive Director of Destination Angels Camp. And we are in partnership with the county and with the Chamber and Public Health Department in bringing these webinars to our various industry groups. So I welcome everybody joining us. I also try to help our Angels Camp businesses work through this maze, you might say, and making sure they're doing the right thing so that they're comfortable and confident when they open up their businesses and encouraging customers in the door. Two of the things that I always caution people as they reopen is if you've been closed for a while, it's a good idea to check with your insurance company to make sure you're quote number one still insured, that you're in compliance with anything that your insurance may require of you because of the business that you're in, and to check with any kind of industry association or licensing partnership that you may have. In this case, with today's session, the Board of Cosmetology, they may have some tips, suggestions, handouts, anything there that might help you reopen, and again, doing the right thing to keep customers safe as well as you and your employees safe. So there are lots and lots of resources out there, and it can be very overwhelming at times. So I just encourage people, before you want to slam your fist down or put it through your computer screen, to feel free to call Kathy or Megan, myself, and Colleen, and we can help guide you through some of these websites or help you understand some of the language.
Yeah, thank you. And Kathy, do we officially have you on now?
Can you hear me on my cell phone?
Faintly, faintly. You want to introduce yourself?
Can you hear me?
Nope, I cannot hear you. Okay, I'm gonna bring you in. Let's see here. Okay, what about now?
Can you hear me now?
Yes, yay. Welcome to the call.
Thank you. Thank you. Sorry, I couldn't get my video to work. I was having a lot of problems with our IT. We're having some broadband capacity issues because we're using so much Zoom in the county, and there's not a lot available to go around. But thank you for having me today, and I'm glad everybody's here to join us.
Can you mute your computer for me, Kathy?
Hmm?
Can you mute your computer?
How's that?
Much better. Yep.
Awesome. Good deal. So one of the things that we're talking about today is the guidance that the state has put out and the checklist. And really the purpose of it is to keep ourselves, keep our family, keep our customers and our employees safe. That's really the overarching importance of the measures. Employee training. I know a lot of our salons don't have employees. They may be owner operators. Some may have employees. And then control measures for screening and cleaning and disinfecting. And then, of course, as we all know, the social distancing piece and keeping that safe distance. But knowing that as we are working with our customers or you know, working with our clients, that there's going to be some close contact. So the one thing that I've been getting a lot of questions on is a written work site specific plan. There is no one size fits all. There have been very different types I've seen. And actually in the business toolkit, there is a draft in there, a sample, and then there's other sample forms. These are great. So there's a sample worksite specific plan. So this one was for one that was a retailer, but basically, you know, it's an owner going through and identifying where their most important areas are, where there's a high risk of exposure or contamination, and then just kind of evaluating those and what your mitigation actions are. The next piece that's really important is employee training. And I know that, again, some have employees, some don't, but some of the links that are actually located both in this document and the guide really point to great topics of discussion. You know, so what are the top topics of training? Is it cleaning? Is it disinfecting? Is it, you know, self-screening at home? There's a lot of different topics. This is a great sample checklist. And the important thing for employees to know, or employers to know, is to, if your employees aren't feeling good, have them not come to work. If you're not feeling good, please don't come to work. And then in talking with your customers, and I'll get into that a little bit more, making sure that you're not touching your face, adjusting your face coverings, and then touching someone else. And I know it sounds silly, but wash your hands. I think everybody's tired of that whole spiel, but wash your hands, wash your hands, wash your hands. It's really important. So Colleen, if you want to pop on here, I believe that anything on the self-screening and at home screening for temperature, I think it's anything over 100 degrees, correct?
Yeah, that's correct. And it doesn't matter. So if people are doing it at home, you know, use whatever thermometer that they have. If it's the old school kind, that's good. If you're doing it though, if you're screening folks when they come in, so for example, I know the guidance suggests you actually screen customers. It's great if you can use either one of the touchless ones or one of the parts, one of the ones that goes across the forehead or the traditional ones are less desirable because then you have to get close to them. But if you do, you need to sanitize them in between each person.
Awesome, thank you. So for the salons and barbers, both the worker and the customer must wear face coverings. Now, face coverings are very different than face masks. And I know that some think that they're the same, but they're very different. Face masks are the ones that are actually worn by our healthcare professionals, our first responders, and the like. The face coverings, I think most people have seen them. They're pretty much the cloth kind, or they may be, you know, a OSHA approved face mask that may have been expired, or so there's quite a bit of difference between those. So face coverings is what they're saying. And what's allowed? Haircuts, weaves, extensions, braiding, lock maintenance, which I don't know what I know what locks are, but maintenance, wig maintenance, hair relaxing treatments, and color services. What's not allowed, and this is, we're getting a lot of questions on this, is anything that touches the customer's face. So eyelash services, waxing, threading, facials, those are not allowed at this time. Another thing about the face coverings is they should be washed. If you have the cloth ones, they should be washed after every shift or each day. Most people have a couple different ones that they have, so they can wash one and wear one. So also is ensuring that you and your workers all use gloves, especially when you're performing your job duties. Most salons do, especially if they're doing a coloring treatment. And wearing gloves should be done in conjunction with regular hand washing. I know you're going to get tired of hearing me say hand washing, but it really does matter. It really, really does. And, you know, it doesn't substitute, you know, wearing gloves, which to me are really uncomfortable, number one. But number two, it doesn't protect you if you touch something with your gloves on and then touch a customer or touch your face. The gloves aren't going to protect you from transferring that. So again, you know, hand wash. So some other suggestions that are in the guidance, which a lot of us already know, or a lot of salons that I'm aware of know, is that staggering your schedules. The good thing, I guess, about Calaveras County salons is there's not the big giant New York style salons where you've got, you know, 40 stylists and you've got, you know, all this stuff going on, people stacked on top of each other, people crammed, people waiting and waiting. Most of our salons are of a smaller nature and allow for staggering of schedules. You might have one stylist that comes in on Monday, Wednesday, Friday, and another one that comes in on Tuesday, Thursday, Saturday, or a couple that come in on a kind of a staggering schedule. So that's helpful. And it also helps that there's not too many people in your shop at one time. So how do you maintain 6 feet of physical distancing in a shop between workers and their customers? Well, you don't. So let's just get real. There's no way I'm going to get my hair done and somebody's going to be 6 feet away from me. So again, the importance of the face covering is critical, and just trying to not be in each other's close proximity for any longer than is necessary to get your customer through. This is pretty standard. Avoid sharing of equipment. So we all know that salons and barbers fall under the state's licensing guidelines. They're very strict as far as, you know, sanitizing and, you know, all the requirements and procedures that you have to do. But, you know, avoid sharing of equipment, blow dryers, clippers, scissors, curling irons, and even things like pens, phones. Most people use their own cell phones now, so there's not really landlines, but really follow your state licensing for disinfecting in between your customers. And then frequently disinfect commonly used surfaces like counters, door handles, shelving, and, you know, those types of areas. And the cool thing that is actually in our toolkit is display signage in your shop. Let your customers know all the great things that you're doing. I know it's kind of like bragging, but it really will make your customers feel a lot more comfortable if they know that these are all the things that you're doing. Some people are still really uncomfortable going out into public and having these interactions. And some people, they're not worried about it at all. So there's some great signage in the toolkit that you can just print off and put up, letting folks know this is who we are, this is what we do. Morgan actually has it up on the shared screen right now. And obviously, you know, let your customers know that if they're not feeling well, please don't come in. And another one that's tough, and I know this is especially for young parents, is not having kids and extra family or friends come with your appointment. So I know that there were times that my niece would get her hair done and she'd bring her whole posse with her while she was getting her hair done. So we want to discourage that type of behavior and just make the appointment for the one person. Obviously, if they have a small child and they can't find care, but you know, you're going to have to use your own discretion. Another good tip is if you can, when it's not 105 like today, have your doors open. It makes it easier for people to come in and out. It brings in fresh air and ventilation. It's a good way for air exchange. And then adopt a daily wipe in and wipe out process. I know most salons and barbers do this anyways. They have to sweep and mop and do all those things, but just, you know, have your daily wipe in, wipe out process and train your employees on it so that they know. And make sure you plan that you have time. So don't book an appointment and then go, oh, dang, I still need to wipe in this morning. And then there is the list, the EPA list. So I know that Morgan talked about the supplies and materials that we have locally, but there is a link here because initially when we first started doing this, a lot of the businesses we talked to couldn't get cleaning supplies. I know I still can't at home. So there is an EPA list that is in the guidance, and so that's there. But I think Morgan, I mean, I don't know, are there any questions at this point?
Yeah, I'm gonna have actually Nicole hop on here. Give me just a moment. Nicole, I'm gonna bring you on. You are on, Nicole. Can you hear us? Nicole, are you there?
think Nicole needs to unmute.
There we go. You're super faint.
Yeah, no, I think I just clicked on the wrong thing. I don't have a question, but thank you.
Oh, okay, got it. All right, what about Veronica? Veronica, did you have a question? You might be.
Okay, I just unmuted myself.
Oh,
Sorry.
okay, perfect.
So in regards to the signage, I know there's multiple signs on your website, but do we have a place where we can download those, or do you have copies of those that we can pick up? Obviously, I've gone into doctors' offices, et cetera, and there's so many signs you can't see straight. So I just need a resource to get those and make sure that we have them posted properly.
Yeah, absolutely. So I can answer that. So I'll go back here and show you again where this is located. So if you go to, let's see here, let me pull it up, calaveras.org. And actually there's a banner up here that says back to business. You can click on that. And if you scroll down, that kit that has all of that signage that we've been scrolling through and all that information is right there. Also, if you are going to be picking up the free PPE from me at the chamber, then you are more than welcome. I can have that signage printed for you if you just let me know ahead of time. So I am more than willing to have that available for you as well.
Thank you very much. I appreciate that.
Yeah, no problem.
Yeah.
Did you have any other questions, Veronica?
Not yet.
Okay. All right. Thank you.
Thank you. I'm just going to let you ladies know that I've been seeing some messages on Facebook saying that people weren't able to get onto the Zoom. And I actually had to contact Debbie Ponte. She emailed me as I was still, I've done a gazillion Zoom meetings lately, it seems like. But I don't know if there's any way you can put it on your website or whatever it is that, what the webinar ID number is, or at least make sure that if you're going to put this on a YouTube or something, that that is definitely out there. And I will be happy to do that on my media, social media, and text people that I know in the industry also.
Oh, thank you, Veronica. Yeah, I'll look into that. We will have that up probably within the hour. I'll have this posted and share it out on social media. Additionally, it will be updated in the Back to Business Toolkit. If you look in that toolkit, we have video links for all of the other ones that we've done, as well as any other resources connected to it. So thank you. Thanks for letting me know. That's not good if people were trying to get on top there. So.
Yeah, fantastic. Thank you so much. I know you guys, I know this, everyone is trying to get used to this. And it's not easy if you don't do it every day.
It is. It's a little challenging for sure. So thank you.
So there's a couple other tips that are in the guide, the state's guide. Some of them are kind of silly, but I kind of picked out the ones that I thought were most pertinent, especially to our communities. So I know a lot of times people do text, and what they're recommending is that you call to confirm your appointments the day before and ask customers how they're feeling, make sure that there's no signs of a potential COVID symptom before they come in, or whether they may be exposed to somebody who has been sick in the household. So if the customer says, well, yeah, I've got a little bit of a sore throat, or my son or my husband has been kind of sick under the weather, it's recommended that you reschedule their appointment for at least 10 to 14 days in the future. So I know it's kind of weird because we normally don't get that personal, like how are you feeling before you come, but it's part of the guidance that they're requiring for you to follow. So I think there's an easy way to do that. And then just, have clients text you or virtually check in when they're there. I know I'm notoriously late when I go to my appointments, unfortunately. and sometimes my gal will be running a little bit late. So rather than waiting in, the salon or into the shop, just ask your clients to text you when they get there, and have them wait in the car until you're ready to see them. And give yourself some time between appointments. I know a lot of times we're trying to, accommodate all of our clients and our customers, and make sure you give yourself time so that you can clean in between. Stagger your appointment. Go ahead.
Oh, I was gonna keep going, Kathy, and then we have a question. Keep going, sorry.
Okay. Stagger your appointments and only work with one customer at a time. I know that you guys have probably been so far behind on your clients and everybody wants to be first. I know I do. You should see my roots. Maybe that's why I'm not on the video. No, I'm just kidding. But, stagger your clients, and have them, and only work with one customer at a time. I know there's times back in the day that, my hair might be processing and then somebody else comes in for something else, and, my stylist could work between a couple of people at the same time. Again, that's discouraged. Just don't wash and cut while another person's hair is processing. So go ahead, Morgan, there's a question.
Oh, yeah. So Elizabeth had a question. She said, is there going to be different guidelines from hair to nails?
The answer is yes. So when we have been reaching out through our contacts at the state and various levels of organizations and associations, we were hoping that nail salons would be part of the quote-unquote beauty barbershop kind of family. It was not. Again, I'm not sure why. I know that there is obviously a closer contact, but I mean, when you think about it, most nail salons, they have masks on, and obviously you're not going to be 6 feet even when you get your hair done, but so I think that there's also a concern that there's a longer potential of exposure. Waxing and, facial treatments, obviously that's like in your face, like it really is in your face. So I believe that there'll be other guidelines coming out for that. I don't know when, hopefully it will be soon. And yeah, so they're different.
Awesome.
So a couple other tips in the guidance. I'm almost done with this part. Ask your clients to come in with clean, wet hair to limit the amount of time spent in close proximity. Some people do this, some people don't. Usually when I go to the salon, I want the full meal deal. I want to be able to relax in the wash basin and get my hair scrubbed and scalp massaged. But if you have some folks that are concerned, have them come in with clean, wet hair, and ask them to, it's just one of those strange things, trying to find ways to just, decrease any impacts and any sickness. And again, your clients need to wear face coverings, wash their hands before they come in, or use hand sanitizer, and discouraging bringing family and friends. And of course, the Chamber talked about the wonderful PPE program that they're doing right now with supplies and resources. Morgan, do you still have hand sanitizer and such available?
Hand sanitizer, no, unfortunately I don't. I have gloves and masks, and this is all state issued to the Health and Human Service Department from the county, and so we've partnered with them, and we're very grateful for all of this. It's just we don't have any more in the near future coming. They're hoping to have some sent over, so hopefully soon, fingers crossed. But no, but just down the street from us, Hunt & Sons does. They have just hand sanitizer, and again, the two other vendors that I posted there, Scott's Distribution and Ferguson, both have hand sanitizer as well.
Awesome, thank you.
Mm-hmm.
For the last couple things, besides cleaning and disinfecting high-touch areas, doorknobs, and cabinets, this is the hard one. This is a really tough one, folks. In maintaining your social distancing, no handshakes and hugs. And this part just really bums me out because I'm a huggy person, and really, we're going to be missing our people and missing, you know, those interactions. But yeah, no handshakes, no hugs. It sucks. And then the last piece is, if you can, complete your payment of the transactions electronically. I know I use Venmo. There's also PayPal and Facebook. There's some great ways out there where we can do our transactions electronically, so we're not having to handle cards and cash. And that's about it.
Or if you're using Square, just have them slide their card instead of you using it if you have the attachment. That's an option too. Elizabeth had another question. She was wondering if there's an ETA on nail guidelines.
So if I had a crystal ball that worked, I would say, I don't know, a week or two. I don't know. I know that there is, you know, a lot of discussion about various industries that haven't opened yet, like health clubs and fitness centers, which we'll be talking about this afternoon. The lodging industry, that's a whole nother one. I don't know, Colleen, do you have any insight?
You're on mute. Colleen, if you're talking, you're on mute.
Can you hear me now?
Yeah, we can hear you now.
Sorry, the Zoom, while you guys were talking, that my Zoom went out, and so I just got back on, so sorry. So I was on a call with the state last night, and a lot of people are expressing exactly what everyone here is expressing, which is that for a lot of hair salons, it's very difficult to pull the two apart, and that nails, in many ways, it's actually easier for people to put up barriers around nails because they could put an acrylic thing and put the hands through. And so just know that there's a lot of people that are strongly advocating for that to be one of the next things that goes in. But I do think it's important for people to remember from a public health standpoint that although we enjoy the attestation that we were able to get from the state, but the state is also it's opening a lot, but it also has to wait and see how our jurisdiction responds, meaning if we start to get more cases, we actually were required to put together a plan that says what we would do if we get so many cases that the county gets kind of overrun. And so I think they're just trying to take their time by releasing things every, couple weeks. It gives us time to make sure that the disease isn't getting spread rampantly throughout our community. And then, we'd have to go backwards. So, but know that people are really passionately advocating about the nail situation for sure, as well as the facial situation, as well as the massage situation. So just know that that's happening.
Thanks, Colleen. I have a couple of questions here. Jamie is asking, is there an end date for these requirements?
This is Colleen. There is the state has not given that that end date to us at all. What it really depends on, there's so many factors that it depends on. It depends on how we as a state go. It depends on how the county goes. It depends on how the country goes. It depends on if this virus decides to have a second act. It depends on a lot of things. So unfortunately, we don't have an end date for any of this. I'm sorry.
Okay. And then another one, Lori has a question. Do we have the same opening day for senior retirement facility that has a salon in it?
So I'm not sure about that because it kind of depends on a variety of things. So if the facility has been allowing people in and out, that's one thing. But if they've been kind of on lockdown, then that's another thing. So I think that is a great question, but it's the devil's in the details. So maybe you can email Morgan or me, and we can figure that part out.
Okay. I'm gonna put or actually, Colleen, if you wouldn't mind throwing your email in there to let them know too. Thank you for that. And then Elizabeth has another question. She says, if we use the shields, do we still need to use the other masks? I'm guessing you meant the other kind of mask, the face coverings.
So I believe that the recommendation is, and I'm not positive for hair salon, but for other folks, the recommendation is to use both. So I would imagine it's probably both. So the advantage to the shield is that if it covers your eyes, because if you look at the guidance, they want you to actually cover your eyes and your mouth and nose. So I think that that's kind of the only advantage really to that.
Mm-hmm. Okay.
And if I could just also share one of the things in the guidance that's also really important that is also unfortunate. I know Kathy was saying it's hard because people can't hug and you know, shake hands and different things, but there's also the portion of the guidance that strongly suggests that we not engage in amenities like magazines and books and coffee and water and snacks and different things like that. I know that when, you know, I know that hair salons and to some extent barbers also want to make, you know, a very welcoming environment. But that stuff is strongly recommended to not be in there. And you can imagine why. We don't want people hanging out, but we also don't want people touching the same stuff over and over. So I just wanted to make that point.
That's really good insight. I didn't think about that, but that's true. There's a lot of multiple touch points there. Debbie, did you have anything you wanted to add?
You know, one of the things I get out of these particular webinars is hearing from some of the folks listening in and some questions or comments they have. I think out of all the webinars we've had, this is the most that we've had attending. So I'd like to know if there's anybody out there that has a question or comment. If we can't answer it, we certainly can get the information for you. So I see some familiar names on there. Questions, comments, chat?
Well,
it's odd that this group is so quiet. Usually they're not.
well, I thought it was pretty entertaining when we were posting the advertisements for this on social media, how many people were tagging their hair designers, their hair people as like a, hey, we're open, I guess. I need an appointment. We haven't had that for any other industries. So that was pretty awesome.
I see a couple of hands, but I'd also would like to know if the Board of Cosmetology has been active with our customers here and what we might be hearing from there.
Okay, well, we just had Sissy come on. Sissy, can you hear us? Or we?
Yeah, I can hear you. Can you hear me?
Yes, we can.
I'm
Awesome.
sorry, I forgot to turn my music off. I'm sorry, hang on. Pause. So I'm hearing a lot of suggestion and recommendation verbiage. And just wondering how we walk through this when we have a lot of suggestion and recommendation. We suggest you wear this, or we recommend you do that.
So this is Colleen. The reason that the guidance is written that way is because it's important to remember that we are all kind of on the same page, right? We're all trying to protect our community and protect each other. Public health will not be coming to your business and you know, checking this and checking that. You're all adults, and we know that you value our community as much as we do. And so I think that that's why it's written that way. It's not meant to be punitive. It's actually meant to be exactly what it says as a guidance, so that we can all be safe and keep each other safe. So I don't know if that answers your question.
Yeah, thank you.
Did that answer your question?
Yes, totally answered my question. I appreciate that.
Awesome. Thanks, Sissy.
So this is Kathy again. I just went to the barbercosmo.ca.gov, and they posted something different, which this is not a surprise. A lot of our state agencies, our organizations and associations are updating. This is a really fluid situation. They're updating their websites like sometimes 4 or 5 times a day. But they actually, I just found, and if I can do a share screen, I'll show you where it is. Go here. Nope, I can't do it. But I'll post the link in the chat box. But it actually has a really nice reopening checklist. So I think it's maybe a little more specific to your industry. Let me put it here. It's called Returning to Work Checklist. And again, you may make this part of your written plan as well. So.
All right, we have a few other questions. So Jamie's asking, is the face shield required?
This is Colleen. According to the guidelines, it is. And it's not, sorry, not a face shield. Sorry, not a face shield, a face covering. The face shield, which is like that clear plastic thing that sometimes you see folks, is not required, but a face covering is. And again, that's different than like an N95 mask, which you wouldn't want to wear all the time. Trust me, those are, they're difficult. So it's just a face covering.
So it sounds like the face shield, if you have it, can maybe be a little easier to operate for, but it's allowed to be used in lieu of the face mask. Is that correct? Or the face covering, I'm sorry, Colleen.
No, sorry. So I am not positive on this and I can investigate it, but I believe with a face shield, you still have to use a face covering, meaning you have to, the face shield would only help with the covering of your eyes. It would not help with the covering of your mouth and your nose.
Okay, got it. Veronica had a question. What about people who are claustrophobic and don't want to have a mask on?
So again, while I'm incredibly empathetic to that situation, it may not be a good time for them to really actually be out in public or get their hair or other things done, because remember that the face covering is for a couple of different reasons, but it's to protect people themselves, but it's also to protect others. As we know that this virus can be transmitted without people having symptoms as well. And remember that the face covering, it doesn't have to be any particular kind. So it just has to cover your nose and your mouth. It doesn't have to be super, super tight either. It just needs to work as a barrier between you and others.
Awesome. And then Jamie also wanted to comment. She said the board has not contacted us other than original email. So she's probably talking about the Board of Cosmetology, I'm guessing. So Kathy posted the link that's in the chat box there. Does anybody else have any other questions that we can try and answer for you or get some information for you?
I have a question for kind of everybody that's on the call. If there's nothing else that comes in, I'll wait.
No, go for it.
So one of the things that the county, the city, and the chamber have been working on is identifying financial resources. I'm wondering how the salons and barbers have fared through this financially, whether they're in need of financial assistance, whether they received it through the EIDL loans or the PPP program. I just kind of want to reach out and see how that went.
Do you want them to hop on or leave you comments in the chat or email you? How
Whatever works.
Okay.
They can email me. I put my email in the chat. If people want to hop on, that's great. However, I would like to know, because I'm looking forward at our recovery, which I believe is going to be a while for our entire county, and whatever information and I can get from the various industries, that'd be great.
Okay. We have a couple questions that I'm going to have Colleen talk to us about one last thing. Jamie asked, is massage excluded? So I'm guessing, is it excluded right now?
So much to my enormous disappointment, it is not included in this current guidelines. I think that a good way to think about the approach that the state has taken is when you think about massage, you're kind of right in there with each other, and you've got, there's a lot of contact. It may be a while, unfortunately, until massage gets opened up, only because it's so close. And so if you think about as they're starting to open things up, I would imagine massage would get opened maybe in late phase 3, but I can't confirm that. But right now it's not.
Okay. And then Sky Villa Salon said, if a client refuses to wear a mask, do we need to ask them to leave?
So this is Colleen again. I would never presume to tell you how to run your business. I think that is entirely up to you, but I will say that the entire purpose of this guidance is to really keep everyone safe, keeping your employees safe, keeping you safe, keeping your customers safe, and people walking around without face coverings is at this point deemed a high risk or unsafe.
Okay. Colleen, do you want to share?
Yeah, so I just wanted to share with folks that starting Friday, there will actually be a state-run testing site in Calaveras. And it's exciting because part of the attestation that we have with the state says that we have to get a certain number of community members tested. And a lot of people kind of think, well, why do we want to get a lot of people tested if they don't have symptoms? It's a way that we do surveillance in public health, particularly around communicable diseases. So we want to get as many people tested in the county as we possibly can. And so a way to do that is, like I said, we have this new testing site. I'm going to put up onto the thing here real quick, sorry. The website that I just put on there is where you can go to register and to make an appointment. And like I said, it starts on Friday. And what I want to be really clear about with everyone is that it asks a bunch of questions, but those questions don't make a determination as to whether or not you will be tested. Everyone can be tested. You don't have to have any particular set of symptoms or any particular anything. You can just be tested if you want to be tested. And if you don't have insurance, you don't have to pay for it. If you have insurance, if you have a copay, you don't have to pay the copay. It's really set up to make it as convenient as possible. If people don't have internet access, they can call this phone number. The only thing I will caution people about is this is a phone number for everyone in the entire state. So it tends to take a lot longer than if you just are able to go online and register yourself for an appointment. And so they're just asking people to make appointments so that people aren't just showing up because we don't want lines, and with the heat and things, it would just make it more complicated. But the testing location is at the fairgrounds. And like I said, appointments will be open starting on Friday. So if anyone is interested in getting themselves or others tested, please consider registering on that site. So thanks.
Awesome.
That's
Thank
awesome.
you. Yeah. I'll just do one more plug really quick that on behalf of Health and Human Services, we do have masks and gloves, free PPE for you in the interim until you receive your PPE order. And so if you do in fact need supplies, please contact me. I'll put my information in the chat again one more time, but please contact me to make an appointment. Every once in a while you can catch me when I do a run into different communities. So just be in touch with me and we can get you your free PPE.
And I just want to do a shout out to Morgan, who's been amazing in hosting not only our webinars, but also the guidance, the toolkit, the PPE. You're an amazing resource to our community. And to remind folks that this webinar is being recorded. So if there are people that weren't able to get on or that couldn't make it for whatever reason, we will, Morgan, of course, because she's fabulous, will be putting that up on social media. Thanks, you guys.
Yeah. Debbie, did you have anything else?
No, I just think those that are participating, I think it's a great crowd out there, and it's nice to have it posted so we can continue to refer people to the website.
Yeah.
But more importantly, just assuring everybody here that they can reach out to any one of us, and we'll do their best to answer your questions and get information you need to be able to reopen your business and get back on track and be successful.
Great. Thank you, Deb. Thank you so much for all of you that joined us live. I'm so appreciative, and truly, this is only as good as you guys make it. So thank you for the participation. The questions are great, and we want to keep the dialogue going. So if you're watching this as a recording, please put your questions below, and we'll, between this wonderful group of women right here, if we don't know the answer, we know who does. So we will find out for you. Thank you guys so much. Appreciate it. Congratulations. You're going to be super busy, I know, for the next couple of weeks. So hang in there and take care. Be safe.